Hello, welcome to our virtual information event. My name's Sam Rhodes, I'm the Lab Manager in Care Birmingham, and this is...
And I'm Rima Rajkhowa. I'm one of the consultants here, a gynecologist and subspecialist in this area of medicine, and I'm also the medical director here. Welcome to the meeting.
So today we're just going to run through a few slides with you, some information about what we do here at Care, both in Birmingham and Care-wide really, and answer any of your questions at the end as well. So please make sure you do pop on your questions so that we can answer them for you. And of course, anything more personal, we can do those at a later date. Ms. Rajkhowa will be starting the presentation now, and I'll catch up in a minute.
Lovely, thank you, Sam. So we are based at Care Birmingham, but the Care family is growing and we are present worldwide. In UK itself, we have a large number of clinics all over UK, which is really good. So we have expertise that we share amongst each other, as well as new clinics coming up in Spain and the US. So you can see that we have a huge amount of worldwide experience and are really getting to the frontiers in this field. At Care Birmingham, we've been established here for 5 years, and we hope that we will be able to answer a little bit about the fertility investigations, the journey, and how we can help you should you need any advice regarding conception. So to start with, I would like to introduce Shah, who is our head of patient experience. She and her team will be on standby during this meeting and after this meeting to help you with any admin queries that you may have regarding visiting the clinic or booking a consultation or finding out more about what we can offer you. So let's start with fertility. I would like to talk you through the journey that some couples or some patients need to go through, and we'll start with what we can offer you at Care. So we understand that 1 in 6 couples or 1 in 6 patients will have some difficulty in achieving a pregnancy when they are ready to start their family. This can cause a lot of distress and this can cause anxiety, and we are here to help you understand what could be the possible reasons, what could be the possible solutions, and it might be just a question of waiting and time, and that is all you need to get pregnant. But if you need anything more, we can talk you through a basic understanding of what your options are today. So at Care, we first of all, if you need to have an understanding about any delay in getting pregnant, then we offer you a consultation. At this consultation, you'll meet with a consultant like myself, who is experienced in this field and has worked for many, many years helping couples like yourselves. Before you meet us, we do like you to have some tests so that we can have a meaningful conversation. The first is this blood test, and this is a basic test that we need, which tells us one simple question: what is the store of eggs in your ovaries currently? We want to know what your pelvis looks like. Is there any anatomical issues? Is there endometriosis, fibroids? We look at your ovaries, and for that, we ask you to have a pelvic ultrasound scan. And of course, the male partner, we always want a semen analysis report. These are the only 3 basic investigations that we need you to have before you come to see us, because quite a lot of the rest of the information will be available to us from your medical history. These tests will help us not only give you a diagnosis as to what could be the problem that you're having this delay, and it will also give us a guidance as to what is the best way possible that we can help you achieve a pregnancy in the shortest possible time, with the shortest amount of invasiveness, and with the best chance of success. So you will see there one of my colleagues having a consultation with the patient, discussing the medical history, the test results, having a diagnosis to say what could be the possible reasons, and then making a plan as to what the next steps could be. It could be something very, very simple, such as tablets to boost ovulation. It could be something a little bit more invasive, such as artificial insemination, or it could be IVF with or without a technique called ICSI for fertilization, because we know that these are the three basic treatments that can give you a very good chance of achieving a pregnancy and live birth, and it is out of the research remit, and it is a good standard clinical medical management plan that we'll give you. So we'll start off by making a plan, giving you a diagnosis, making a treatment plan, and you will be offered a lot of written information, and that is accessed by you through what we call the patient portal. This is what it looks like. The patient portal is available to you on a desktop, on a laptop, on your mobile, or on a tablet, and you can access it any time of the day or night or evening when you need the information and when you have the time to go through all of that. And this is really helpful rather than having lots and lots of paper, because this is there for you all the time at the touch of a finger. So once you've read the written information, once you've looked at the cost, once you have understood why you need the treatment, and you've had all your queries responded to by us and the team, which includes the admin team called Care Pals, the nursing team, the medical team, once you're clear and confident about the decision to proceed, then you go ahead. And today, I'm just going to speak with you, Sam and I, just going to go through the IVF process with you, just to give you a little understanding of what is involved. So in a natural cycle, every month you would have the potential to grow, say, 10 or 15 or 20 eggs, but nature allows only one to become mature and ovulate. In IVF treatment, we are helping you achieve a pregnancy by a technique called assisted conception. That means the first step will be the use of hormone injections. And these hormone injections make the little follicles in your ovary that are there, all of them, not all of them, a good number of them, grow to maturity. This is because in an IVF cycle, we hope to give you not only just the one embryo for a blastocyst for a pregnancy, but hopefully give you a few more to spare embryos to freeze to give you further options for the future. So the first step is hormone injection. So usually you will have a protocol, and the protocol is explained to you in a nurse planning appointment, and you can see one of our senior nurses here on the screen. We have fantastic nurses led by Melody, our nurse manager, and Helen, our deputy nurse manager, and many others who are all very experienced fertility specialist nurses. They will see you for a nurse planning appointment, and they will go through every step of the treatment journey from the day you begin your first injection. You'll be taught how to give yourself the injections, either face-to-face, or you'll be given an online summary about how to draw it up. And these injections are hormones to make you grow the follicles, which are little bubbles in your ovary which contain the eggs. And while you're taking these injections, we see you for regular ultrasound scans. So the first phase of your treatment is the hormone injections with the regular ultrasound scans to measure how you are responding. At this scan, you can see that we're having a scan. This is our scan room. As you can see, it's a beautiful room with lots of space, and you will be given a huge amount of space and dignity and privacy to have the scan, and the scans are done by the very highly trained nursing or medical staff, and we will see how you're responding to the injections. And once you are ready, after about 10 or 12 days of injections, you will be ready for what we call the egg collection procedure. So the egg collection procedure is done in the clinic itself. You will be given sedation by either a nurse sedationist or by a consultant anesthetist. We have both available. The sedation is not an anesthetic, so you are pain-free, but you can wake up very quickly, which is excellent because it's short-lasting. And the egg collection procedure itself only lasts about 10 minutes. There is one needle entry in the vagina to the ovary on each side. And we aspirate the fluid, as you can see here, the needle going in to the ovary, and we empty the follicles. And as we empty the follicles, the egg is sucked out with it. And this fluid, which is aspirated from the follicles, is then handed over to the laboratory. So we have the theatre with the anaesthetist there. You are being sedated, and a specialist medical team, member of the team, a doctor, will be doing the procedure. And within 10 minutes, all your fluids, all your follicles will be aspirated, and you will be back in the ward. You will wake up as soon as the procedure is done, and you will be comfortable and free of pain. And in the lab now, I will let Sam tell you what goes on there. It's all magic.
So once we've had those eggs collected and we've safely popped them away in our incubators, we then go on to the other element, which is the sperm collection. So we either have fresh or frozen, and that can either be from a donor or from a partner sample. What we'll do is we will have that collected or defrosted, and then pop it through a series of washes and safety steps to make sure that it's clean and ready to use for fertilising those eggs we've just collected. So this can normally be through a series of washing steps, so we can get the best sperm and select those best ones for the fertilisation procedure. So as Rima's just touched on the IVF process, we have there's a small tube there full of sperm showing you that depiction, and we would count it, look at it very carefully. Here you can see actually one of our intelligent computer systems. We do this both by embryologist eye, who's been trained for many years, or we do it using a computer system. This is tracking little individual sperm that you'll see there. We'd like to select the very best and quickest sperm for the procedure, and that's what the washing steps do really. And we also like to look to see how they are looking, so if they're looking abnormal or normal. And as a guide, we would need at least sort of 4% normal looking to go with our standard procedure, and we can offer the ICSI for when we don't quite meet that criteria. Everybody is different, and we treat you all as individuals. So with the IVF, it's more straightforward. We add this processed sperm and the eggs together into small petri dishes, as you see sort of traditionally, and that would be done in the afternoon after your egg collection, and after we've spoken to you both to go through all the information as to how the eggs look and how the sperm are. We would do that in the afternoon and look in the morning for fertilisation. This is very similar to how we do the ICSI procedure as well, which I think you'll see on the next slide. And that's ever so slightly different. And all that is that you can see an egg there. That egg has been collected, selected by the laboratory, and then a single sperm that is the best of the group is being injected into every single egg that is mature. We aim to get a good maturity rate, normally about 80% of those eggs we collect will be mature due to all the hormones and the stimulation you go through. And the idea is that that sperm is physically injected into the egg to really give you your best chance if the sperm need a little helping hand, or if you've got any other etiologies that we think might benefit from an ICSI before. So for example, if we've not seen you in clinic before and you've been trying for a long while. So after we've looked at all of these eggs, in the morning we wake up, we run into the lab and we have a look to see if they are fertilised normally. And should they be fertilised normally, they then go on to develop over about 5 days usually. And they'd go from a very small 1 cell, you can see in the corner of the screen, onto 2 and 4 and 8, and really develop over the week, which is fascinating for us to see. Our embryos are either in our standard incubators we've been using for 30 odd years or so, or they are using our Care Map system as well, which I'll come on to in a minute. In fact, here's a video of it now. So this is probably day 3, day 4 cell embryo, starting to develop and divide. We watch them all the time, and the Care Map system is a time-lapse system essentially, but with the added sort of computer software algorithm that helps us predict which of those embryos are going to form those babies. So we have many, many years of experience of those that have formed babies, and we look at all their data compared to those that unfortunately haven't, and then we can help us predict and pick the very best embryo for you in a scoring system that we use, and that myself, the lab team, and also the consultants will go through with you for when you go for transfer. We also won the National Technology Awards for this technology that we use. We're very confident with it, and we found that it has really helped quite a lot of our patients. So, yeah, we were just having them, we watch them, we do the embryo transfer later on as soon as they are ready to be fully fledged. And I think there may be a video in a moment about how we do something called genetic testing. There it is. So this is something, an extra add-on. Not all patients will require it. And there'll be a lot of information given to you if this is something that you would require. This is for a subset of patients who would need to know whether their embryos are normal or abnormal, or it would benefit their treatment plan. You can see here an embryo on day 5 of development. It's about 100 or 150 cells. We very carefully take maybe 5 cells maximum away, you can see there in the viewer, and send those off to a genetics lab that's linked with Care. And we can see from those cells the rest of the embryo, the likelihood of it being normal or abnormal. And that's really helpful for those with recurrent miscarriage, those with more advanced maternal age, or many different reasons that it could help patients with a quicker time to pregnancy and hopefully a reduction in miscarriages. But again, this is quite a complicated procedure that we would go through with lots of detail. Both the consultants and the lab team would talk you through it really carefully to see if it's for you. So I would say really now, once we've looked at them in the laboratory, we've decided if they're developing well, if they're doing nicely. Ideally, we would transfer a single embryo for a healthy mum, healthy baby. And if we can have any extra embryos, we would try and freeze those for you as well for a use at a later date or for siblings. We'd analyse them, confirm it with you, discuss it with you, and then look to do the embryo transfer. So here in Birmingham, our embryo transfers are done by our consultants. It's consultant-led care, and it's not usually done under sedation. It is normally more of a straightforward procedure that would be normally in an afternoon or early, late morning. Really just to transfer the one embryo, very sort of quick, pain-free. Normally takes 10 to 20 minutes, depends how long we're talking about our embryos and if you've got any questions. And again, it is in our nice theatre where you've come from a collection. And
just wanted to also say that we always do this under ultrasound guidance. So you will have a nurse scanning you abdominally while the consultant does the procedure from below. And we always welcome both partners to be present. You know, your partner will be very welcome at this appointment to be with you in theatre, because we think this is an important moment for both partners, and we would really like you all to be there together. As Sam has explained, the embryo transfer process having been done, you will then be given some paperwork to giving you instructions about hormone support that you will need to take in the period until the pregnancy test. And that we understand is one of the most difficult times, because it's the waiting, which is hard, and we will be there to support you. I wanted to speak about all kinds of support that we have at Care. We have the nursing team who are very, very brilliant. They are supportive, they're kind, and they understand your worries, and they're there for you. We, as the medical team, will always be there for you. And of course, we have many other support mechanisms that are there, which includes the care pals who are there to pass on to support you and to pass on any queries that you may have to us, so that you have a reasonable answer at a reasonable length of time. We have other supports like the support counselling. So we have independent counsellors, and Care Birmingham, we are so fortunate that we have 2 excellent counsellors who are there to support you through your treatment journey, during your treatment, before or after, whenever you need them. All you have to do is go and make sure that you make an appointment when you feel you need to speak with someone. In addition, of course, we have the Fertility Forum, which I believe is very, very good and very supportive with a lot of members. It is run by patients, and we, the medical team or the embryology team, are not involved in that, but I'm always told that it is really helpful if you need it. And of course, you must never hesitate to ask if you have any concerns or questions. And this is what is really important, to know that you are able to ask us questions and to be reassured if you have any concerns at all at any time.
That's what we're here for.
Exactly. And we would really, so this was just an overview about a straightforward IVF journey. But as Sam said very clearly, that we do personalize the care to your individual needs. And that is something that we would definitely say that, for example, there are some couples who may need treatment with donor egg or donor sperm, and we would be able to support you through that. And we have an extremely good teams who are dedicated to offering support for these particular different treatment options. We have an egg bank, and the waiting time for donor egg is quite short. And of course, we have the Care Sperm Bank, and we also have arrangement with other sperm banks that will help. And I think Sam can tell us a bit more about that.
Yeah, absolutely. So we've selected the best sperm banks in the business that we know that are reliable, that ship good quality sperm, and that also are very quick to answer our questions, and also have also compliant with all the our regulatory body, the HFEA. So it's very important that you get a donor that's suited to you, both personally and also with your characteristics, but also that they are suitable for use. There's a list here on the screen that we work with here at Care, that we've got third-party agreements with. What we wouldn't want to do is use a bank that wasn't validated. So it's all very well regulated. We're here to help you buy it as well. Obviously, the Care Bank's very good, and the waiting list is getting shorter every week. But also the option to go elsewhere is fully supported as well with us. So plenty of options.
We are a licensed clinic by the HFEA, so we are very closely regulated, and we are very clear that we want to absolutely ensure that your safety is paramount. We'll look after you and make sure that you're well looked after. The National Surrogacy Awards is another big winner. So Care is very good in offering all kinds of treatment, and surrogacy is one of the treatment options that we offer patients here, because there are couples who unfortunately may not be able to carry the pregnancy themselves. Then we support them with a host surrogate, and we are very proud to say that we were the National Surrogacy Award winners for this year because of the well-programmed, because of the very clear knowledge, clear pathways, and the actually getting the patient all the way through from the first consultation to the pregnancy is something that we really pride on about our surrogacy journeys. So that is really something that I would say Care is excellent, and at Care Birmingham we are very experienced in offering this service. So support, as I've said previously, it's very important to acknowledge that your feeling is valid. Your journey is your own, and you must always remember that you are not what somebody else is experiencing, and you therefore must remember to talk to us and take our support whenever you need it.
Yeah, we often say comparison's the thief of joy, don't we?
It is, and it's so important to remember that the experience of another couple or another person doesn't reflect the whole treatment. Your treatment is your own, and it doesn't have to be in any way be reflected by another person's. But of course, we always learn from others as well. So we are willing to listen and to modify and to look at your thoughts. And so it is important, but you mustn't get upset because of another story. So yeah, so we just want to know you to know that there is support here from ourselves and from all the other things that we spoke about. The social media channel as well, where there is regular support. So last but not the least, of course, is financial assistance. So IVF treatment, you will always at the very first initial consultation be provided with a cost estimate for a single cycle, the cost of your medication, the cost of any tests that are required before you begin treatment. And in some couples, if you think it is necessary and appropriate, we may advise you to have additional tests to assist you with implantation if there has been recurrent failed implantation, or you need special laboratory techniques such as pre-implantation genetic testing to reduce your time to pregnancy. So we are very careful and very clear that we provide you with clear cost estimates. And of course, we also have the Care Pay funding package, which I think works very well for some patients because there are many different options, including the refund package or the multi-cycle package, which includes frozen embryo transfers and other add-ons like care maps. And we have teams who will be available to speak with you about the Care Pay funding package should you wish to know more about it.
I think Chloe's just popping the link on actually now, which would be helpful for you all to see if you do need to see it.
So I think we are close to the time where we can do the Q&A sessions, because we can see there are quite a few questions coming up on the notice board. So before we conclude, I would just like to highlight that this slide gives you the contact number for the patient inquiry team. They're available to book appointments. You can do that by going through the link, which will be available to you directly through a web form, or you can call them and find out more about what we can offer you and whether this is something that you wish to consider to come and speak with us. And of course, as you know, we would all be very happy to go through any queries that you may have.
I think there's also a discount as well, should we have any conversions tonight.
So from tonight's discount, if you book a consultation, please do quote the virtual event October so that you can get the discounted consultation appointment, which I think would be a good opportunity for us to understand what your needs may be and give you perhaps an understanding of where the treatment should be directed, should you need any.
Thank you for listening as well.
Thank you.
Half an hour of us talking. Now on to your questions.
So I'm going to ask Sam to start with the dashboard, because you can do the questions and we can do the answers together.
Okay, so I'll answer some laboratory ones first, and then I shall direct some to Mr. Rajkhowa. So one of our attendees has asked, would embryo glue make a difference to implantation? So that's a $1 million question really there. We do lots of research on embryo glue, both care and across the world really. It's a very interesting and useful product. It's not for everybody. It can be used for most patients, but we tend to be quite targeted with our add-ons. We wouldn't want to sell you something you wouldn't necessarily need. However, we have seen that it can give an uplift in the pregnancy rate. So for those who don't know what embryo glue is, we have all of our embryos in a special media for all of our embryos. And then at the embryo transfer, you can opt for the additional embryo glue, which is a more viscous or sticky media, which is why we call it embryo glue, which has the same sort of protein or covering that the embryo would have, which helps the womb and the embryo interact and recognise each other. So we have these naturally, but it's sort of an increased concentration of those particular proteins. And for that reason, we find that the embryo and the womb can see each other a bit clearer, interact more, and it has been shown to improve implantation in different target patients, but also for all patients. So we can recommend it for all, but it hasn't shown a wonder, miracle difference, which of course we have to be careful with what we're advertising. We're very much compliant with all of our regulatory body. It would be something that the consultant would discuss case by case, looking at previous cycles or your previous history perhaps as to whether it be good for you. So I hope that answered your question. If not, please get in touch with us. So I think the other laboratory question really was, what does a semen analysis tell you? So good question, yeah. So really, it would tell you the, for example, volume of the sperm. So how many of the sample, so how many mils a sample is, if it's too low, or that can be indicative of an issue elsewhere. We look at how many sperm there are, obviously, and have a look to see if there's a very few of them, so maybe 1 or 2, or if there's millions and millions of them. So as a guide, we'd like to see about 15 million being normal, so that's quite big numbers really, and gives you a bit of an idea of how many we're looking at when we do a semen analysis. We also look at how fast they're swimming, or if they're swimming at all, and sort of grade them and have a look to see if they are normally swimming or if they are struggling a little bit there. And also we look at how they morphologically look, so whether they're looking normal or abnormal. All of these things we would go through and basically decide if any of the parameters are lower. That's when we'd be looking at doing the ICSI procedure or discussing a particularly personalised treatment plan with you to sort of help with your fertility journey. When we do the fertility assessments as well, it doesn't always result in a fertility journey with assisted conception. We do the diagnostic semen analysis, which includes things like pH and a few other elements that we're looking at in the sperm, just that might help you. Things like sperm oxidative stress. So sometimes if we have more DNA damage, which we can accumulate or acquire, we might agree a different treatment plan for you or offer you some perhaps antioxidants and things like that. And that's something that we would, as you say, personalised to everybody. So we can really tell quite a lot with the semen analysis. It isn't just the female partner in this scenario. The male partner is very important as well. Arguably 50% is just as important as the ladies. So it is something that's very, very useful. So I'll move on to the consultant questions in the interest of time. And I think one of them is discussing PCOS.
Yes, so the question is, with PCOS, are we likely to produce lots of eggs? So by its very nature, polycystic ovary syndrome, which is what PCOS is, has got greater number of those small bubbles called follicles in the ovary. So if in a young woman of say 30 years of age, you would see normally about 20 follicles in total. In a woman with PCOS, sometimes we can see 40, 50 follicles. So we have to be very careful in an IVF treatment cycle that too many of those eggs don't begin to grow. So it is true that you are at risk of producing more eggs, and we try our best to monitor very carefully by adjusting the dose of the drugs based on the scans and the blood tests that we do for a hormone called estradiol to reduce that risk. But the bottom line is that yes, if you do ask me, are we likely to produce? I would say the risk is higher, though we try and mitigate the risk as much as possible. However, we have many strategies these days to ensure that you don't become ill. We will collect the eggs, create the embryos, and we may decide to freeze the embryos electively to allow your ovaries to settle before we put that embryo back in. So this will not reduce your chances of pregnancy because your best embryo will still be in the freezer. And currently the freezing, thawing process is so well developed. The techniques are so good that we have seen that there is no difference in those patients whether they have a fresh or a frozen transfer. So if you do produce too many eggs, which will try and reduce the risk, and you do need an elective freeze, you mustn't be distressed about it. I hope this answers your questions.
So another prospective patient asks, which is quite a broad question really, what can you do for multiple miscarriages?
It's really hard being pregnant and losing pregnancies, and we never ever can underestimate the distress multiple miscarriages can cause. So we know that recurrent miscarriage by definition currently is 3 or more miscarriages, and they don't have to be sequential miscarriages, they can be in any order. Mostly in the NHS, you will be referred to a recurrent miscarriage clinic where baseline investigations are carried out. And you will be given these results, and the miscarriage clinics are very good. However, at Care, we can offer you the same investigations for miscarriages, but we are not a recurrent miscarriage clinic. We are a fertility clinic. And so in the context of subfertility with multiple miscarriages, we would offer you further more detailed investigations, which could be for sticky blood. We may check your chromosomes, we may check for autoantibodies, or for other factors that sort of more sort of controversial forms of treatment, if you like, but not to manage multiple miscarriages, only if it is associated with subfertility.
So another patient asks about technologies called Emma, ERA and Alice. So there are 3 other procedures that we can do here. And the prospective patient's asking, when should I do these tests? Which obviously can vary.
So the question is very good. It says, when should I do the Emma, ERA and Alice test, if at all? So that's very important, that if at all. So the Emma test, ERA test and Alice test is done on the tissue taken from the lining of the womb with a biopsy. So obviously it's an invasive test and must not be taken lightly. We offer the ERA test, called the endometrial receptivity assay test, only if you've had failed implantation. And by that definition, it is 2 or more failed implantations. So in this clinic, and generally it is with a frozen embryo transfer that you need an ERA test. So if you've had 2 or more failed frozen embryo transfer, then we would offer the ERA test to see, are we putting the embryo back in the correct implantation window? However, the Emma and Alice test are slightly different. They are looking at any absence of good bacteria called microbiome or lactobacillus in the lining of the womb, or Alice is looking at low-grade inflammation of the lining of the womb called Alice test. They come together as a package. So if we do the ERA test, we will do the Emma and Alice at the same time. But some patients have had Emma and Alice test without the ERA test if they've had situations like if there has been failed implantations with early bleeding, where we're not quite sure if it is due to a bacterial imbalance. So the question is, should you have it only if you've had recurrent failed implantation, which by definition is 2 or more failed implantations? ERA is mainly related to frozen embryo transfers, as is Emma and Alice, but on occasion, Emma and Alice can be discussed on an individual case outside the ERA endometrial testing.
We've got quite a personal question here asking us, would we recommend that you check your fertility? This is a, I presume, female, biologically female. I'm 32, not currently in a relationship, but I think I need to know where I am so I can plan for the future. So this is very quite common actually nowadays.
What do you think, Sam?
Do you think I'm 32? So it's very interesting, really. We do offer fertility assessments here, where we can look at, as you say, the AMH and what your ovarian reserve is. It may be that you have a very high one, it may be that you have quite a low one. So that's one of the first steps. There's quite a lot in the media about egg freezing, which obviously we offer here, as well as the technology to see what your eggs look like as well. So we could freeze eggs and also have a look at your future potential using AI software to see if they would be likely to form a baby in the future, or likely to form a particular level of embryo development called blastocyst. So all the options are out there for you to use if you feel you wish to. You don't know if you're going to meet Mr. or Mrs. Right round the corner, however. So that's more of a personal question than what we can answer. But certainly if you're 32 and you are worried, potentially looking down the fertility assessment route might be the best option for you, just to give you that peace of mind and that information. And then you can then decide what you do from there. You know, if you have plenty of eggs and you don't want to go down any routes, that's fine. But if it's more of an urgent need, or that may become an urgent need, you can perhaps look at freezing your eggs and use them in the future with us.
I think that's a really good answer, and it sort of really states that 32 is a good age if you're not in a relationship to think, if you wish to have, if you're really keen to have a family in the future, to just have an assessment. I think it's reasonable thing to think about.
Similarly, someone has asked, when do we recommend donor eggs, which is the other end of that scale?
Yeah. So really, donor eggs is an option if a woman is unable to achieve a pregnancy with her own eggs. So if you look at age, unfortunately, women are born with a limited number of eggs. And as we grow older, the number of eggs in our ovaries do diminish. And along with the reduction in the count of eggs in our ovaries, the quality of the eggs also deteriorate, the miscarriage risk go up. So when do you recommend treatment with donor eggs? It's got to be very individual depending on the circumstances. But if you're 43, 44, and you have a low store of eggs, I would say definitely 44 and above, 45 and above, we would say that the chances of pregnancy, even with IVF treatment using your own eggs, is very, very limited. And that is the time when we would probably think that if you wish to consider donor eggs, that may be a reasonable option.
I agree. Yeah, absolutely.
So we have a question here. It says, would we recommend a second egg collection to someone that still has 6 embryos in storage? I've had 2 failed implantations so far, and I've had mild adenomyosis and PCOS. 2 failed implantations, I assume, was from the same cohort of embryos. And there are 6 embryos still in storage. I think the important bit of information missing there is about age. If you are young and less than 35, I would consider that with 2 failed implantations, that perhaps it may be a little bit too soon to consider a second stimulation cycle. We could consider testing your embryos with thawing and doing pre-implantation genetic testing of the embryos to see if they are normal. And if they are normal and they have still not implanted, then we have protocols for recurrent failed implantations where we would make sure. So you have just got a message that the patient is 29. Then in this situation, I would probably say that let's look at other reasons why embryos have failed to implant. Yeah. Is it the embryo or is it the uterus? Is it the lining? Is there receptivity issues? So in this scenario, if I was saying you, I would probably say, let's look at recurrent implantation reasons, failed implantation reasons, look at some investigations there, and we could certainly test your embryos to see if they're chromosomally normal, though the likelihood is high that they are. And it depends also on the grades of the embryos frozen. They may be frozen, but they depends on how good they are and how robust they are. So we would work together and then decide whether you needed a second. I would not say that you need it immediately.
Yeah, I think we'd need the full picture, wouldn't we? But that's what we would discuss in the consultations.
And we are very fortunate that we have multidisciplinary team meetings regularly, once every month, where all of us will sit together, all the senior consultants, senior embryology team and nurses, and we will discuss patients with this kind of a problem so that we have everybody's concentrated advice, and then we would formulate a plan as to how best to manage.
Absolutely. So we have one last question for us here, and it says, can we treat patients with fibroids?
Depends on how big the fibroids are and where they are and whether we can see the ovaries. So it would have to be individualized based on the fibroid, the status of the uterus really, because fibroids can be within the cavity, they can be small or they can be large. If they are small and the ovaries are visualized and the fibroid is not inside the uterus, in the cavity itself, then yes, we would treat. But if they are large and we can't see the ovaries or the fibroid is sitting inside the cavity, then of course we would have to manage the fibroids first.
That's for your safety, isn't it, really, as well? We want you to be both safe and also pregnant.
And
So,
successful. Yes.
That would be what we would advise. So from what I can see, I don't think we have any more questions directed straight to us. Just flicking through, apologies for our screen. So I know Chloe is our marketing and PR. She's just looking through everything and checking there's nothing that we're missing at the moment. All the information there about the forum, about booking, about funding. There is a small question here, which has been answered by Chloe, just very similar about having multiple miscarriages, sadly, and unsuccessful IVFs procedures, which is certainly something we've obviously already touched on, and we'd be happy to help with the consulting team. And I do think that draws our event to a close. We've really enjoyed sharing.
Thank you so much for being there, and I hope that it's given you some information that may be helpful. And if you would like to book an appointment, we'll be very pleased to see you.
Absolutely. Have a lovely Thursday evening, whatever you're now doing.
Thank you very much.
Thank you. Bye.
Bye-bye.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared for by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what Care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists, our nurses, to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.